to Watch is an intimate look into the lives of prominent and influential women leaders from around the world and the challenges they faced on their journey. It's the real story behind her title. Join us every week to hear more stories about women from around the world and in your own communities at womentowatch.net. Hello, everyone, and welcome back to another week of Women to Watch. I'm Sue Rocco. Thanks so much for being with me. Joining me in just a moment will be Rais, and Sherry is the co-founder and CEO of Enthea, which is a third-party licensed administrator working to expand healthcare coverage for people struggling with mental illness. She's a great story. Please be sure to subscribe to our YouTube channel at W2W Media. And don't forget to stay with us during the breaks to hear from our Watch team of corporate partners. So now I'm very honored and excited to welcome to the show, Rais. Sherry, welcome to the show.
Thank you for having me.
It's great to have you. I'm so interested and fascinated with this topic and the work you're doing around expanding access for healthcare coverage for people battling mental illness. And we will dive into that and talk about Enthea, the company that you are the co-founder and CEO of. But I want to kind of dive in and learn a little bit about your upbringing and what you think led you to do the work that you're doing today. So why don't we start with give us a little background on first your mom and dad immigrating from Pakistan to the United States and what brought that about.
Yes. So my mother is actually from Tanzania and my father is from Pakistan. And my father they met in Pakistan. So they met and fell in love. And then my mother first left and went to Canada. She was able to get a visa and was looking for a better life like many other immigrants. My father got accepted into University of Houston, so he went to the US, but chasing my mom because they were writing each other love letters. And then eventually they got married and settled in Canada together. And fortunately had me and my brother. But that had a profound impact on my life, them being from that part of the world, because they taught my brother and I, just how lucky we are to be born in Canada and to have a comfortable life. When I was young, my parents would take us back home to Pakistan and I would see where my dad was from. And I was very aware from a young age. I think the first time I went was grade one. Could be mistaken, but I think it was grade one. And even then, it was clear to me that, oh, wow, I'm so lucky that everything is much more comfortable for me back in Canada. So it kind of instilled like a sense of wanting to even the playing field or wanting to help others, because I felt like I had an advantage.
From what you've shared with me, you certainly had an innate desire to help the less fortunate, and it showed up very early. You shared with me having a lemonade stand. You were only 4 years old, and you did that with the idea to give the money you made back to people that needed it. So, tell me where were you first exposed to people less fortunate in Toronto
Yeah.
and having that desire to help?
Yeah, so I think in Toronto, we grew up in the suburbs, so outside of Toronto in a small town called Newmarket, which didn't have a lot of poverty or anything like that. But we belonged to a community because my parents are not from Canada, and the Muslim community. So we would go to mosque on Fridays. And when we would go to mosque, that is one place where I would see, like, oh, here's people who maybe look like me but seem to have less. So it kind of opened my eyes. Not that everyone had less. Some people definitely had more and had nicer cars, but there was all people from all different socioeconomic backgrounds, and I started being exposed in that way that people had less. And that was an area because in our community, volunteering is a really important pillar. And so, even from a very young age, I saw my mother was volunteering at the mosque, my family members were volunteering at the mosque, they were trying to help others. And that's probably why, from even a young age, I mean, hard to tell nature versus nurture. Some part of it might have been just in me, but those external factors definitely had an influence to your point. When I had a lemonade stand at the end of the summer, my parents were so excited. I had made $500. They told me to put it in a bank account.
Wow,
Yeah,
that's a lot.
yeah, yeah.
People
Um,
were generous.
Pardon?
People were generous for the lemonade.
I was also a little bit of a hustler with my lemonade selling by going twice. It wasn't a stand. I would go door to door, and
Oh my
I would go in
gosh.
the morning and the afternoon, and who's gonna say no?
Right. Oh my gosh.
Um, and so, they were surprised when at the end of the summer they said, "Okay, let's open a bank account and save this money." They wanted to teach me the concept of saving, and I had the concept of like, no, I want to give it away to people who need it.
Wow. How did they feel when you decided in 10th grade that you wanted to go to an area of town where there were many homeless
They
and spend 2 nights there alone? That's really brave.
They don't know, and I've mentioned it on
Oh,
podcasts before. No, it's fine. I'm waiting for the day they actually listen to one of the podcasts I'm on where I speak to this because once they don't know about it actually, and so maybe they'll find out. But
wow.
yes, until today they haven't asked.
So you didn't have an opportunity to have a conversation with them about that.
I may have bended the truth quite a bit and just told them I was sleeping
Okay.
over at a friend's place. I guess the people are on the street were my friends eventually, so
Right.
yeah.
What did you, I mean, I'm assuming you've had several revelations from that opportunity. Tell me about the people that you spoke with, and is there one in particular who you met that story kind of stayed with you?
One in particular story definitely stays with me. So, one big takeaway I had from that experience was that mental health is pervasive. And really, that's when I realized we don't have good solutions in place. And we can't be blaming people who are homeless for their situation because in almost every case, they're suffering from mental health issues that have not been properly diagnosed or not been properly treated. um, and at least it might be different in other parts of the world, like going back to Pakistan or India, where there's just like absolute extreme poverty in so many areas. In Canada, in a first world country, let's say, or in a developed country, often people think that homelessness is someone's choice or someone's fault. But the experience definitely made me realize, no, this is not someone's fault. This is really like the failing of our system to address the mental health issues and to make services properly available and distribute resources. But the story that stood out was, I was pretending to be homeless, so I really had to actually sit and beg in order to make money in order to buy a meal. I had some extra money in case nobody gave me money. I think I took like $20 with me. But other than that, I was like had a hat out and was asking for money. And one man who, well, I don't think his name matters, but just for maybe privacy, although I guess it won't say much, but one man, let's call him Jesus. He walked by when I was begging for money, and he was homeless, and he emptied all of the money from his hat into my hat. So he was giving me all of his own money, even though he was homeless. And I ran after him and told him, like, oh, no, no, like, you can't give me your money. I'm not actually homeless. Take it back. And then I also wanted to, like, give him some of the money I had on me. Like, I'm so sorry. Like, I didn't, you don't need to give me your money. And he said, I know you're the girl that's talking to people. Cause I was doing kind of my own version of interviews. He's like, you're the girl, like, talking to people about being homeless. I was like, yeah, if you knew that, why would you give me your money? Like, if you knew I wasn't really homeless. And he's like, I imagine I was watching you, like, now you know what it feels like to sit there and beg. And I was like, uh-huh. And he's like, and you know what it feels like when people walk by and ignore you? And I was like, uh-huh. And you know what it feels like, to not exist? And I was like, uh-huh. And then he's like, I wanted you to know what it feels like to be seen. And so that
Wow.
really, really stuck with me, and that's, um, probably the reason why, since then, I've made a very intentional effort to at least once a week, if I can, wherever I am in the world. There are some places where homelessness doesn't really exist, but wherever I am, to try to feed the homeless or help the homeless, like, in an intentional way, because he really, like it really made me think that, like, yeah, it's true. Like sometimes we're busy, we walk by homeless people and we just act like they don't exist. And it's really unfortunate. So it doesn't take
Yeah.
much to smile and make eye contact and give something.
Yeah. So tell me then, when after you were in high school when you did that,
Yes.
and where did you go to college, and what did you study?
I went to McGill for my undergrad degree, and I studied psychology and international
Okay.
development. So I kind of knew from this upbringing that we're talking about, like, I'm interested in mental health, especially from that high school experience. I want to understand how to solve these issues, but I'm also really interested in working in low income countries and, going back to places not necessarily where my parents are from, but in that region of the world. Because I don't like that some countries are so rich and some countries are not. So that's why I studied international development as well. And then I did grad school at the University of London and did public policy and management. So that's what I studied.
And I know you spent some time at World Bank
Yes.
and the UN. Tell me about your time there and what you learned.
So I was consulting to both organizations, and in that capacity, I was working on something called cash transfers, which is the idea of giving money to the poor. Some people call it, know it as universal basic income. Universal basic income is when you give money to everyone. So whether you're rich or poor, everyone gets this certain base level amount in order to meet their minimum needs. When a country can't afford to give that money to everyone, they'll give it to the poorest of the poor, or they'll give it to a certain bracket. And the idea is that you give not enough money to create a dependence, not enough money to pay for everything. It's not enough to pay for all of your bills, but it should be that, just that, like, right amount. And there's a way to calculate how much is the right amount based on, different factors in that country's economy, but sort of just enough so that you're not in absolute poverty, so that you have a little bit of a boost, so that if you are in poverty, you can get out of poverty. That's kind of the idea. And so I worked on programs that did that, and was involved in programs that did that in over 30 countries, mostly in Africa, some parts of Asia, and some parts of South America.
And when I think about it's such a complicated issue,
Yes.
right? Homeless, and obviously you're focused on the mental we'll say mental illness, but
Mhm.
well-being as well. And so it's very hard, I think, in trying to solve this problem, to give the money that's necessary for them to be okay. But we know that if they're not treated for the mental illness that they're suffering from, they will never be fully um, able, excuse me, to reach their potential. So, did you recognize that early on when you were doing that work?
In all fairness, I went into that work naive. Like, why I studied psychology in undergrad was like, I'm gonna go champion mental health all over the world in low income countries, and and then I did public policy, like, I'm going to put this on the agenda. Like, that was my, young, naive, ambitious thing. But then when I started working on cash transfers, to be honest, I got so engrossed in, it's pretty complicated to, like, design and implement a cash transfer and roll it out nationally and train staff to implement it. So I got quite engrossed in that and for a little bit, stopped thinking about the mental health component. And I was really like, okay, let's make sure we, you know, implement this project, and let's make sure we do it on time, and let's make sure we do it well. And I had all these metrics. So for a while, I sort of stopped mental health moved to the back of my mind, if I'm being completely transparent. And then it was only after a few years when I started to get involved with impact assessments and reports looking at outcomes of these projects that we implemented. And we started seeing, okay, well, how effective was that program? How effective was that cash transfer? And, they vary from country to country, but let's say on average, you're getting 50%, 60%, sometimes 40. So, of people that receive this money over a 2-year period, they'll come out of poverty. I would always think then, well, what about that other 50%? What's happening to them? We're giving them money, so by definition, they should be able to come out of poverty, because we're giving it to them every month. It's not like a one-time thing. And so that's what took my brain back to, oh, we're not doing anything to address their mental health issues. And well, if you look at the data, like especially in countries with intergenerational poverty, with places that have just gotten out of conflict or are in the middle of a conflict, like trauma and depression rates are sometimes, quadruple what they are in the US. And so it's no surprise that people are stuck in this poverty crisis if they're feeling so much trauma and depression and anxiety.
Yeah, yeah. Listen, we're going to go into a quick break. And when we
Yes.
come back, I want to talk about the moment you decided to start Enthea.
Okay.
Stay with us as we go into a break where you hear from our corporate partners, and we'll be back with Rais.
As a female-led organization, you have to bring it every single day. We're a mashup of sort of right and left brain. So we're not just doing management consulting. We're not just doing creative services. We're not just producing an event, but we're bringing a comprehensive solution to our clients. And because of the way we approach it, we end up being bought into what it is that we're doing in a way that we truly have as much skin in the game as our clients do, whether it's bringing affordable internet to communities across the Caribbean, or it's helping Comcast with their Internet Essentials program, which is something we've been very proud to work on, or it's helping the NFL celebrate their centennial season by getting 1 million people to give at least 100 minutes to causes they care about, or helping the city of Philadelphia win the World Cup. So what's next for us? Well, we just hit just over 100 employees. I think we are at that tipping point, and I don't think there's anybody that does it better than we do. I'm Maggie Wilkinson, CEO of Athena Global Advisors, a company that is proudly based in Philadelphia.
Ladies, I'm Tiffany Curden, a financial professional with more than 25 years of experience serving successful women, families, and businesses. Here's the reality. You don't have to be the one managing your family's finances to take ownership of your future. But if you want true confidence about how everything is going to play out, you do have to take part in the process. That doesn't mean digging into the weeds of your finances when you don't have the time or desire. It means elevating your awareness of your own circumstances. It means having the bigger conversations so you're empowered when you need to be. Let's bring confidence to your family's future without overwhelming your time. Call my cell at 903-520-2709. That's 903-520-2709. Or visit Johnson Financial Group on our website, www.jfg.cc. Not .com, www.jfg.cc.
Hi, I'm Dawn Zier, CEO, Board Director, and Executive Mentor to Fortune 500 executives through my work at the Exco Group, firm of experienced CEOs, board directors, and global business leaders who offer real-world experience to help organizations and senior leaders grow. Today on Leadership Watch, we're going to talk about being in the driver's seat of your career. No matter what stage you're at in your career, you need to grasp that you are in the driver's seat. Understanding from day one that you and you alone are responsible for your career is critical. After all, why would you hand your career over to someone else to manage? There's no one as vested in yourself as you, and the ugly truth is that most managers are focused on execution rather than team development. So how can you ensure that your career stays on track? First, make sure you have a clear set of agreed upon goals that are measurable, and if priorities shift, rewrite them with buy-in. 2, If you see something that can be improved upon or automated, don't wait to be asked, just do it. This is good advice for tech-savvy millennials and Gen Zs who can help lead the way with AI. 3, don't insulate yourself. Get to know other parts of the organization and network both internally and externally. Feel free to drive outside of your lane. And 4, while your career is yours to own, don't go it alone. Identify sponsors and mentors. Also, it's important to make self-reflection and self-assessment a habit. Think through where you want to be 5 years from now and create a roadmap for yourself. Does your current path get you there? Are you passionate about what you're doing? Do you feel challenged? Are you learning? Do you feel respected? And importantly, are you a cultural fit? And is the company a cultural fit for you? If you answer negative to any of these questions, it's likely time for some course correcting. Please follow me on LinkedIn at Dawn Zier. And if you're a senior executive looking to grow in your career, check out excoleadership.com to learn more.
Welcome back to the show. I'm joined this week by Rais, and Sherry is the co-founder and CEO of Enthea, which is a third-party licensed administrator working to expand coverage for people suffering from mental illness. Sherry, I'd love to ask you, what prompted you to start this company?
Thanks. So, as I was explaining before the break, I was working in low-income countries, and after just over a decade, really starting to see how much of a mental health crisis we live in. Specifically, in low-income countries, 82% of people living in low to middle-income countries suffer from a diagnosable mental health condition. And as I started seeing that and facing that firsthand, I began to look for solutions to treat mental illness. And that's when I really started to see how ineffective most of our solutions are at scale. That doesn't mean they don't help anyone. I'm sure people listening to this podcast have experienced some sort of symptom relief or help from therapy. I'm a huge proponent of therapy. Some people have gotten better through medication. I'm really happy for them. But the data shows that these solutions just don't work for most people. In fact, what we know is that up to 60% of people with a diagnosed mental health condition are treatment resistant, meaning the existing options don't work for them. We also know that antidepressants have moderate to severe side effects in 58% of people that take them. And some studies show that only 15 to 20% of people that take antidepressants experience, a lot of relief. So some relief, yes, some symptom reduction, yes, but to say that it's working really well is very rare. To stop talking in numbers, is very rare to meet someone that said, "Oh yeah, I was depressed, then I took this antidepressant, and then I started feeling better, and I'm off the antidepressant. I'm doing great." Like,
Right.
woohoo! That's so rare. What you normally hear is, "I suffered from depression. I took some meds. I played with the dosages. I took some different meds. I played with the dosages. I'm still on the meds, managing my symptoms." That's usually the story.
In
And
conjunction with therapy, right? You're saying that even
yes,
both medication and therapy together
yes,
are not working.
they're working for some, but not
Mhm.
working for most.
Yeah.
And so then I looked a little bit deeper, and I am a little bit of a nerd and I'm very data driven. And so I stumbled upon this is while I was still working and living in Africa, and I stumbled upon research around innovative treatments like ketamine assisted therapy, psychedelic assisted therapy, TMS, stellate ganglion block. These treatments that don't come to mind when you think of mental health treatments, and some of them actually have a lot of stigma associated with them. But the data I was reading was showing really profound benefits. We're talking to the scale of, in clinical trials, anywhere from 65 to 85% of people saying they did just one to a handful of sessions, so 1 to 5 sessions, and they would come out at follow up no longer having depression, no longer having anxiety, no longer having PTSD, no longer being addicted to alcohol, no longer smoking. Like, it's beneficial for a wide variety of indications. and such significant results with medications or treatments that don't have a lot of side effects. They're not something you need to take every day, like with antidepressants. So it's just a few administrations, and are overall fairly safe and not addictive. So as I dived deeper into this data, I started talking to people who had uh, gone through these treatments and hearing more and more stories. One side of it is the data, and I'm all about reading numbers, but I started talking to people who had actually benefited from these treatments, and eventually people I knew and cared about started trying these treatments, and I started hearing all these stories, and really witnessing transformations. People who I knew and cared about who underwent psychedelic therapy or underwent ketamine therapy, and I was witnessing complete transformations, total breakthroughs. As I saw all of that and combined, what I was witnessing with all of this data I was seeing, I really just thought about how many millions of people could be helped if these medicines were more available, were more understood, were less stigmatized. They didn't have a cost barrier, they didn't have an education barrier. And that ultimately led to me helping, along with others, create Enthea, which is all about creating a solution to bridge this gap, to make innovative and evidence based mental health treatments available to people safely and affordably and at scale.
When you were learning, Sherry, about when you were
Yes.
discovering it, was it at that time legal around the world? Is it a treatment that was ever not legal?
So, psychedelics, the word psychedelic means mind manifesting and can refer to many substances. Traditionally, when one thinks of psychedelics, they think of maybe psilocybin, commonly known as mushrooms, or LSD, commonly known as acid, or MDMA, commonly known as ecstasy or Molly, recreationally. These medicines are not legal in the US yet, just to be clear. Psilocybin is decriminalized in some places. They've all been given breakthrough status by the FDA. It is legal and available in the state of Oregon and Colorado. So those states have made it available, psilocybin only. And again, different places have decriminalized it. But at the federal level, these medicines are still not legal, still not FDA approved, but they have been all given breakthrough status by the FDA. Ketamine, however, has actually been around for 60 years or more. It is on the World Health Organization's list of essential medicines. It's used as an anesthetic. It's available in almost every hospital and ambulance all over the world, not just in the US. So there's a lot more data on ketamine's efficacy and safety profile because we use it even in children in higher doses as an anesthetic.
So, just to be clear, your
Yes.
company is working with employers
Yes.
to help them, right? To have the health benefits
Yes.
for the treatment. You're not working with individuals. I wonder if you can first tell me the difference between ketamine and a psychedelic, and what does a patient actually go through that is
Yeah.
changing, components in the brain that kind of help them see, and this is my lay version of what I've been reading, but they kind of go to a place where they come face to face with the trauma that they faced, and then they're able to see it more clearly and let it go. But give me, the correct terminology for what a patient goes through in these treatments.
Yes. So, with both ketamine and so some people, I'll say ketamine is considered to some people a psychedelic, to some people it's a psychedelic like substance. I won't delve into the nuance of I'm not going to be the deciding person of whether it is or it isn't, but I like saying psychedelic like because, it keeps
At a certain
everyone.
dose, perhaps, maybe it's right. It can
Yes, it
mimic
produces.
a different dosage than what they're doing in a hospital for surgery, for example.
Correct, yes.
Okay.
But traditional psychedelics will work on the 5-HT2A receptors in the brain, which is related to serotonin. And ketamine will work on the NMDA receptor in the brain. So they do work on different receptors in the brain, not to use too much jargon. However, the process or the protocol for both psychedelic assisted therapy and ketamine assisted therapy is similar in that it starts with an assessment, so a medical and psychological assessment. You'll see your provider, trained clinician, and determine if you are even a good fit for this treatment. Maybe you're not because of family medical history. Maybe you're not because you're currently pregnant. There could be a few reasons why you might not be a good fit or because of the medications you're on. But first, you determine if you're a good fit. And then if the provider determines you are a good fit, you'll do what's called preparation. And in preparation, you are working with your therapist, maybe not your regular therapist, but your psychedelic or ketamine therapist who's trained in these modalities. And you are preparing for your psychedelic experience, or we're going to call it psychedelic slash ketamine experience. You're preparing for that medicine session. And sometimes that requires just one session with your therapist. Sometimes it requires quite a few. The idea is that you are preparing such that when it's time for the medicine session, you've kind of minimized the fear. You're not walking in there like that day scared or confused or unsure of what's going to happen. You're calm and you have really clear intentions of why you're doing this and what this is about for you. And then you do your medicine session, and that's again, so the medicine will be administered often by a nurse, depending on the mode of administration, but definitely a clinician. And depending on the substance, it could be psilocybin, it could be ketamine, it could be MDMA. It doesn't really matter which one you have. I mean, it matters, but for the purpose of this explanation, the medicine is administered, and usually you'll wear an eye mask, okay? And you'll lie down, and often you'll have headphones, so you'll have a playlist, and you'll be in this altered state. And with ketamine, that altered state will last about 45 to 90 minutes. 90 is pretty long. With psilocybin or MDMA, it lasts several hours, so it's a much longer altered state. That's the key difference, many, many hours. And you're in this altered state, you have the eye mask, you're listening to music, and you will feel, with ketamine even more so, like a dissociative effect. So you feel kind of like an out of body experience. And your brain, the neuroplasticity in your brain, the neurons will start firing. Your brain is more neuroplastic. There's beautiful images of the brain on psychedelics, and you see all of these neurons firing. And because of all of those firing connections, you're actually able to, we don't, by the way, I'm explaining something that we don't fully understand. So I'm just explaining based on what we know today.
Okay.
But what we think, because of all of this neuroplasticity that's happening, is you're able to form new patterns. And so, as a really quick example, let's say I go in there always feeling anxious about the lighting I have on podcasts. Like today, my lighting is not great, right? And so I have this thing where I'm always like, oh my God, I always look so terrible on camera. The lighting's never right. And I did this one podcast with Susan, and the lighting was terrible, and everyone's going to make fun of me. Let's just say this is a thing for me, and I struggle with it, right?
Okay.
When I go into that ketamine session, I'm able to then, there'll be often, especially, it's not always the case with ketamine, but always with psychedelics, there's going to be someone sitting in that room who talks you through this experience that you go through and guides you through it. That will help you kind of rewire your brain to think, oh, wait, actually, the lighting doesn't matter that much because I was authentic and I showed up and I was myself and people appreciated that. And they'll forgive the fact that there was bad lighting today, and they're not going to remember it. They're going to remember, the wonderful interaction between Susan and I. They're not going to remember the lighting. So I'm able to rewire that thinking. And then going forward, hopefully on the next podcast I'm on, I'm able to remember, oh, right, I remember now, like lighting doesn't matter as much as I think it does. This is a very simple example.
Right.
But,
Yeah. Yeah.
but it illustrates the point of kind of rewiring the brain in that way. And then after the medicine session, sorry for the long explanation, you do what's called integration. And so for, the next several hours, some people say days, some people say weeks, you're still in a neuroplastic state. And so you'll continue to talk to your therapist in that neuroplastic state without any drugs or medicines to do what's called integration and kind of really cement the lesson so that I can talk to my therapist, a week later and she'll say, remember the mantra, like lighting doesn't matter. Remember we said that. And so then that becomes, a new pathway for me in my brain.
A new pattern, right? A
Yeah.
new pattern from what you've been. So, let me ask you this: how many companies are signing on for this? Because I think ultimately it is a cost saver for them, right? If they're going to cover these treatments for their employees who perhaps have been looking for
Yeah.
treatments for many, many years.
So through our various channel partners and partnerships, we are working with over 60 companies, over 167,000 people all over the country. And that's companies in different industries. Some are unions, some are, just your normal employers, working with EAPs. But yeah, it represents over 60 companies and unions and 167,000 people.
And if I were to ask you, what is your goal for the company? What do you envision, in it expanding?
Yeah, so I want to help 3 million people, just over 3 million people by the end of 2027.
Wow.
I think this is a doable goal just given, like I mentioned, 167,000. A year ago, we were at 500. So the growth has been, quite strong. And we are now, because of just that growth, and because honestly, unfortunately, of how much people are suffering, we're talking to some of the country's largest employers. All of the household names or companies that are ones we're talking to, and everyone's really feeling the unfortunately, like they're feeling the pain of mental health. They're feeling it, and so we're here to help.
I would imagine the more people who come to know someone who's
Yes, that's
done it.
exactly it. It's a
Yeah,
domino effect. So, someone hears about someone who benefited, and then, they reach out to us, they start looking for options, and it's kind of like a chain reaction. And that goes even for when we sign up with a company. It's not like everyone is going to go rushing to try this, but somebody at that company tries this, they talk to their coworkers, and then, more people are interested.
yeah. Is there any place for government to be, or do they need to be involved for regulatory purposes?
Yes. So, for regulatory purposes, the FDA, we are hoping will approve these other psychedelics that I mentioned are not approved. But right now, ketamine is available. But the government also plays a really big role in, the VA approval, for example. Like there's a lot of bipartisan support because veterans are suffering a lot mentally. So there's a lot of bipartisan support and support from the VA to not only look into and fund psychedelic treatments for vets, but also make ketamine therapy available to vets more and more. So there's that. Um, yeah, I would say I don't know how much you in this audience follows politics, but one of RFK Jr.'s first tweets post the elections was actually about healthcare, and one of his first tweets mentioned how he wants to see the FDA approve psychedelics.
Wow. Well, he's certainly one that's, exploring all areas of innovation around healthcare, I'll say.
Yes,
So, it's really interesting, and I think it's like anything else, something that's new that has for a very long time had a stigma, but now can be utilized in a good way.
yes,
I know that you're helping people, and I'm sure that
yes.
it makes you feel very good. And I hope that you're able to help more and more, and that companies can um, start to understand more about it and sign on.
Thank you, Susan. Yeah, and to that point, and I will say that I think what I'm most proud of is so far what we've seen is really incredible in terms of results. We've seen an 86% reduction in PTSD, a 67% reduction in anxiety, a 65% reduction in depression, and 80% of people who have completed ketamine therapy with our providers are no longer on their antidepressants at follow up. So we're actually helping them heal internally so they don't need to take daily medications anymore. And, for anyone out there listening who maybe they know someone who's suffering, or, you're suffering yourself and you've always felt alone in this journey, I'm really happy to answer questions about these treatments, even if your employer is not interested. You asked, like, what does the company want? I want to see us helping 3 million people. Yes, but even personally, what I love doing is talking to people every day about these treatments and helping them find a resource or a therapist that they can go to.
Yeah. Well, we will share your information, and
Yes,
you stay in touch with me, and we'll see what pans out in the future with the entire industry.
thank you. Yes, definitely.
Thank you. We're going to go into our last break, and I'll be back to close out the show. Thanks, Sherry.
Thanks, Susan.
Children's Hospital of Philadelphia has long been ranked as one of the best children's hospitals in the country. In our Women to Watch at CHOP series, we'll meet the women working to preserve this best-in-class pediatric innovation. Let's meet Executive Vice President and Chief Financial Officer, Sophia Holder. Sophia, just take a minute to kind of introduce yourself to our guests. Tell them a little bit about where you came from and how you ended up in this role.
Yes, and thank you, Susan, for just the amazing work that you do to inspire women leadership. I would still call myself as new to CHOP. Started just over 3 years ago, and I'm honestly in my dream job in an organization that is focused on delivering and innovating care for children. And so it's hard not to find joy in that space. My career in healthcare spans many years, starting in the adult side and now on the pediatric side. And I'm just really thrilled to be with you today.
What advice would you have for our listeners and our viewers listening to you today?
So I would offer 2 pieces of advice. Focus on continuous learning. Be a life learner. That's the frame that I often use with those who work with me and for me. Stay updated on industry trends. Continuously seek opportunities for learning and growth. Knowledge is power in any leadership role. I think the other piece of advice I would give is model authenticity. Be authentic and true to yourself. Authentic leadership builds trust and loyalty among your team and your peers, foundational to building effective teams and supporting cross-collaboration and partnership.
Thanks so much to Sophia Holder for joining us. Stay tuned for more Women to Watch at CHOP.
We are CHOP, and we can't wait to show you around. We're the nation's first children's hospital. Now, a care network with more than 50 locations that continues to expand. 3 state-of-the-art research buildings with 1.5 million square feet of space. We have grown from 12 beds 165 years ago to nearly 600 beds and one of the best children's hospitals in the world. We have a level 1 trauma center, 11 floors of patient units, more than 20 operating rooms, first of its kind delivery unit for babies with birth defects, a separate cardiac operative and catheterization suite, and places to learn, like our internationally recognized simulation center. We have trained generations of leaders in the field of pediatrics. We are world leaders in medicine, surgery, and science. One of the top recipients in NIH funding for pediatric research. In this building, pioneers in CAR T therapy, mitochondrial disease, brain tumors, hyperinsulinism, and other rare diseases. Here, groundbreaking work in fetal surgery, genetics and genomics, and neurology. In our newest building, leaders in social determinants of health, clinical informatics and epidemiology, autism, trauma and injury prevention. Our patients come from every state, and 115 countries. Meeting these challenges requires the best and the brightest. We are passionate about pediatrics. We are motivated to make a difference in the world and in our community. We are a team. We are CHOP.
That's it, everyone, for another week of Women to Watch. Thanks for tuning in. Next week, I'll be speaking with Dr. Beth Sanborn, and she is a safety school coordinator in Pennsylvania who spent 26 years as a police officer. I want to say thank you to our sponsors who help us to bring you the show each and every week. And by the way, if you're interested in joining our watch team and be a part of the show, feel free to reach out to me directly at susan@womentowatch.net. Have a great week, everyone.